graduate program, also from Montana, and now obviously with the University of Washington.
Great, yeah, thank you. Good morning, everyone. Thank you for coming to my talk here. All right, so today I'm going to introduce you to a topic that I researched this past summer. It's associated with the University of Washington Department of Orthopedic Surgery. I was looking at the effects of muscle paralysis on tibial bone morphometry in rats, and I looked at them 1 year and 1 month post-paralysis. So this slide just shows a little bit about the background of the program that I was doing. It's called MSRTP. It's a 10-week summer research program. I conducted the research at Harborview Medical Center. It's on the left there, and then there's a view of Mount Rainier from Harborview. Okay, so I used Botox in this study to paralyze these rat muscles. So Botox, as most of you probably know, inhibits that acetylcholine release by binding to the SNAP25 proteins, and we're basically trying to simulate a spinal cord injury in these rats. We're trying to completely denervate the muscle, and so we use Botox to do that. It provides a nice model for us. Okay, so in this study, I had 7 groups of male spray dolly rats. They were divided into 2 groups, and both of these groups received Botox injections into the tibialis anterior muscle mid-belly. And then I had 1 group that was sacrificed at 1 month post-paralysis. I had 1 group that was sacrificed at 1 year post-paralysis. And then the tibias, the ipsilateral and contralateral tibias, were dissected and stored. So really the main idea of this study was to look at the tibias that were paralyzed 1 month post-paralysis and look at the tibias that were paralyzed 1 year post-paralysis and see how the bone morphometry changed by having that rat have the extra year to basically heal the bone. We wanted to see if that would happen. Okay, so again, I just kind of stated the experimental question. How are these rat tibias going to differ 1 month versus 1 year post-paralysis with Botox? So this was kind of a pilot study in our group. Our group has already studied fairly significantly what happens when you paralyze the superficial posterior compartment of the calf. And what they found was tremendous bone loss when you did this in the calf muscle. It basically paralyzed the rat, so its gait and its mobility was severely impaired. And they were seeing like a 45% decrease in bone mass in the trabecular regions and a 15% decrease in bone mass in the cortical regions. So it's reasonable for us to suggest that if you paralyze the anterior compartment of the bone, you'd see similar bone loss. And so that's what our hypothesis was. We were hoping to see roughly about the same amount of bone loss, even though we were working on a different side of the rat tibia. So here's the machine. I should note on the previous slide, the actual experiment with the injections and the Botox and the sacrifice of the rats was conducted by a collaborator at UCSD, Rick Lieber. And so basically they just sent the rat tibias that had already undergone this experimental procedure up to us for analysis. And the analysis that I conducted during my 10 weeks at Harborview was using this Viva CT scanner. And basically this is just a CT scanner for small animals and for the purposes of research. And you can see that blue door on the side of it. You just pop that open and you can put the rat in there. This can be done in vivo or in vitro. So we have a lot of mouse studies going on in our lab. We just anesthetize the mouse and then they can do the scan and wake it up. And so that's kind of a nice thing. Again, my analysis was ex vivo. I just had the tibias. But again, these are examples of some of the images that this machine can generate. It's an amazing machine. It can measure all these little trabeculae, the surface area of them, the thickness, volume, density, and it can give us all sorts of useful values about the bone. So this is just a cross section. There's a top view. Okay, so basically I put the rat tibias into this machine, and I hypothesized that the greatest amount of bone loss was going to be way up here in the proximal metaphysis region. And the reason for that is because that's where the most trabecular bone is housed, and there's so much more surface area on those trabecular bone for those osteoclasts to resorb the bone, that's where it's hypothesized that the bone loss is going to occur the most. And that's just based on previous study of the subject by the lab. But then again, I wanted to look at the cortical region and see what was happening there, how much bone loss was occurring, and also at the distal metathesis. We kind of hypothesized that bone loss would be greater at the distal metathesis than the cortical, but it wouldn't be as much as the proximal metathesis, just based on trabecular number, basically. So down at the bottom here, you can see right there, there's a rat tibia. It's surprisingly similar to the human. They have almost all the same muscles in the lower limb down there. And so I was, again, I was just paralyzing the tibialis anterior muscle really. Okay, so here's my results. Here's what I found. So just kind of taking a broad view at this, you can see that the one on the left has more bones than the one on the right. And so this was in line with our hypothesis. We figured that if you sacrifice a rat 1 month after paralysis, it's not going to have time to regrow that bone that was probably lost by the muscle paralysis. So 1 year there was like significantly more bone than 1 month. So 3.4%, and then 1 month was 9% bone loss. So which you can immediately see that we're not dealing with anything like what would happen when we paralyzed the calf muscle, where we were seeing like 45% bone loss. We're dealing on much smaller scales, and so that was kind of a surprise in this study. And again, this was just a pilot study to see if our research group wanted to put more resources into doing, more thorough analysis. So, and here's what I saw in the cortical region. Same story. Actually, in the 1 month, I actually saw thickening of the cortical bone. That was kind of unsuspected, and then in 1 year there was a pretty small loss in bone mass. Okay, so to discuss this issue and to try to figure out why I got the results that I did, I basically tried to figure out what are the differences between the calf and the tibialis anterior. And so first off, I want to say that the sample size, I was only working with 7 rats, so to make my results statistically significant with an N of 7 is very difficult. So a lot of my results would have become statistically significant if I would have had a few more numbers. You can see I conducted a power analysis here, and there would have been significance in most of my results in the 1 month group had I just had 2 more rats in my end. So the trends were there, but regardless, the results were not statistically significant. And so this last bullet point is kind of an interesting idea. So the way that bone resorbs is on all of these little trabeculae, like I was mentioning earlier. And so the theory is that once these are gone, they're gone. They no longer will come back. So if bone loss is significant enough in the first several weeks after paralysis, then these are never going to come back. But if it's not as significant a bone loss, over the course of that year before the animal is sacrificed, all of these are going to regain their thickness. So I think what happened with my study was the bone loss initially was not significant enough to resorb all these trabeculae, and so then the bone would just come back as soon as the Botox kind of wore off. Okay, so here, like I was alluding to earlier, some differences between the tibialis anterior and between the posterior calf compartment. Mechanical differences, so the tibia is going to be under a different mechanical strain depending on if you paralyze the anterior compartment or if you paralyze the posterior compartment. This theory is kind of going by the wayside as why bone breaks down. People are starting to think that it's more biological differences rather than mechanical differences that cause bone to break down in the way that they do. And so biological differences, obviously there's much different blood supply, innervation. The calf, especially in rats, has a much denser array of capillaries and innervation from the posterior compartment. So if we subscribe to a model that there are metabolic chemotactic factors that are affecting the osteoclastic resorption, then it would make sense that the calf would resorb the bone much more because it has a much more significant neuronal innervation and blood supply. And so this sensory neuron theory is just that. It's that the sensory neurons are providing some sort of neuropeptide that influences the osteoclasts and the osteoblasts. And I think this is a reasonable theory. It has yet to have some significant study, but there are some pilot studies that were published this summer that we looked at that showed that the sensory neurons play a big role in the trabecular regions. And it's also interesting that the most densely innervated region of the bone is this trabecular region. So that may be something